first important thing when patients tell us about their complaints is to identify or clarify the question and the prediction. What is the specific problem they're looking to solve? Or in other words, if we improved their attention and concentration, what would that actually look like in their life? i.e., what problem would that solve? And that's the crucial link, because what we're doing in psychiatry is we are not simply providing symptom relief. We are ensuring that symptoms are managed or controlled, and in some cases relieved, but they translate into function. And that's the link that becomes crucial, which is why these predictions matter. Second, what does he expect treatment to change? The same aspects. Does it mean the task? Does it mean being able to work until 4 o'clock and pay attention? Or if a patient says, I come back after 6 o'clock, I'm working all day, I need to be able to work longer. You see, that's a mismatch, because ideally, if the medication's being used to enhance performance or to stretch performance or to create dysfunction when towards the end of the day the individual needs arousal reduction, then they might be borrowing certain amount of debt, whether it's sleep debt, energy debt, which means that they might have to pay this back at a later time. And this is where we see certain individuals end up in the crash and burn cycle. So a key aspect to keep in mind is, what are they expecting to change? We then try to identify what domains are impaired. And here, as I mentioned, perception, activity, cognition, emotional, hedonics, and sleep. And what might ADHD as a diagnosis explain? What might it not explain? Because as we know, ADHD sometimes can essentially become this whole umbrella term that explains or provides an understanding for the patient that explains everything, when there might be elements that might not be actually linked to ADHD, but rather require behavioral change or personality aspects that might need to be addressed. So that's the key aspect related to this slide. So the patient wants help for poor focus, disorganization, irritability, underperformance relative effort, their chronic sense of mental chaos, and he believes that medication may settle his mind and help him function more consistently. Now, the patient's prediction becomes very important, because sometimes the expectation, and when we use the word prediction, it's a neurobiological term, because the brain is an organ of prediction. Its function is to match prediction with outcomes. In simple terms, it's always trying to make sense of the world. The brain did not evolve to make us happy, to make us feel better. It evolved to help us match prediction outcome. In other words, it evolved for predictability. The more the environment's predictable, the safer the brain feels, the safer we are able to explore and learn. That's the fundamental principle, and this is also linked to the action mode network. We might touch on it later, where humans operate in 2 modes, action mode on, action mode off, both highly intrinsically active states, but we need an optimal balance of both these states. So here, the patient's prediction becomes important, because if they believe that the medication may do something that it can't, then we're always, as part of the treatment, going to end up with a mismatch.